Cements are widely used in dentistry for a variety of applications. Some products are used primarily for cavity lining, while others are primarily used for luting application. Other more specialist products are used for sealing roots canals as part of a course of endodontic treatment. Some cements are specifically formulated as filling materials. These products are discussed in chapters 20, 24, and 25. Some of the material described previously in those chapters are used for a variety of applications, and some of those the discussions related to their use as fillings will be relevant to other application of the same or similar products. Requirements of cavity lining materials. Certain filling materials are not suitable for placing directly into a freshly prepared cavity. In such circumstances, a layer of cavity lining is placed in the occlusal floor of the cavity and on the pulpalaxial dentine wall for class 2 cavities. Prior to placement of the filling, the requirements of the cavity lining material chosen for any specific application depend on the depth of the cavity, which determine the thickness of residual dentine between the base of the cavity and the dental pulp and the type of filling material which is being used to restore the tooth. The purpose of cavity lining or cavity base is to act as a barrier between the filling material and the dentine, which by virtue of the dentinal tubules has direct access to the sensitive pulp depending upon the specific circumstances. The lining may be expected to provide a thermal, chemical and electrical barrier as illustrated. In addition, the cavity lining or base must have sufficient mechanical strength to resist disruption during the placement of fillings and provide firm, rigid base which will adequately support the filling above it. Thermal barrier. The cavity lining or base is often expected to form a thermally insulating barrier in order to protect the pulp from sudden intolerable changes in temperature. The insulating properties of the cement are characterized by its value of thermal conductivity or thermal diffusivity. A thermally insulating cavity lining is particularly required when a metallic filling such as amalgam is used. The thermal diffusivity value for amalgam is about 40 times greater than that of dentine. In deep cavities having only a thin residual layer of dentine, there is a danger of thermal shock to the pulp. When the patient takes hot or cold food, a layer of insulating cavity lining material of sufficient thickness helps to prevent this. Unfortunately, this protective effect can be negated if a dentine pin is used to help to provide retention for a metallic restoration. The interface between the pin and the restoration cannot be insulated, hence condension of thermal change can occur rapidly into the tooth. In shallow cavities where there is a relatively thick layer of residual dentine, it becomes less important to use a lining with thermal insulating properties. Indeed, for amalgam restoration in shallow cavities, the use of a thick layer of cavity lining may reduce the thickness of the overlying amalgam to such an extent that it becomes weakened and liable to fracture. Hence, in such shallow cavities, the base and the wall of the cavity can be lined with a varnish